This one mistake could slowly kill your manhood. After 60, are you unknowingly damaging your penis every single day? Because according to recent data from the Cleveland Clinic, more than 50% of men over 60 are silently suffering from sexual dysfunction and don't even know why. But here's the terrifying part. It's not aging. It's not bad luck. It's bad habits. And if you keep ignoring them, you could be heading straight toward erectile dysfunction, penile shrinkage, or worse, penile cancer. Yes, this is real, and it's preventable. So listen closely. Because I'm about to show you 5 essential penis care tips every senior man must follow to protect his manhood, virility, and confidence. And don't miss the bonus 6th tip at the end. It's the one almost every man overlooks, until it's too late. Let's not sugarcoat this. Here's what's on the line. Sexual performance declines, gradually, then suddenly. Nocturnal erections disappear, cutting off blood supply to your penis. Fibrosis and scarring silently take hold. And worst of all, you begin shrinking. Not just in confidence, but literally. Research from Harvard Medical School warns disuse leads to degeneration, and the penis is no exception. Tip 1. Use it or lose it. Is a medical reality, yes, your penis is a muscle-driven organ, and like any muscle, if you stop using it, it will atrophy. A 2022 study in the journal Sexual Medicine found that seniors who had regular erections, whether through intimacy or therapeutic stimulation, had a 30% lower risk of developing erectile tissue fibrosis. Translation? No stimulation, checked scar tissue, weak, curved, or even painful erections. You don't need to be sexually active to stay healthy. Here's what you can do right now. Vacuum erection devices, approved by urologists. Pelvic floor exercises like Kegels. Even brief manual stimulation, just to maintain oxygenation. Letting it rest for months? That's a dangerous lie. Tip 2. The hygiene mistake that's causing cancer in thousands of men. Let's talk hygiene. It's not just about smelling good. According to the National Cancer Institute, poor genital hygiene is a major risk factor for penile cancer, especially in uncircumcised men. Why? Because secretions trapped under the foreskin can cause chronic inflammation, which over time mutates cells and leads to cancerous growth. So what do you need to do? Use mild, fragrance-free soap like glycerin or baby soap. Always pull back the foreskin, if present, and rinse thoroughly. Dry completely. Moisture breeds bacteria, and never skip washing after sex, because the mix of vaginal and penile pH can cause harmful imbalance. This takes less than 2 minutes a day, but ignoring it for years, that can cost you your life. Tip 3. The half erection. You must avoid. Here's something most men have never been told. Do not have sex when you're only half erect. When your penis is not fully firm, it's vulnerable. You increase the risk of microtrauma, tiny tears inside the erectile tissue. According to the American Urological Association, repeated micro-injuries can lead to Peyronie's disease, a painful condition where scar tissue curves the penis and makes intercourse difficult or impossible. The warning signs? Pain during erection. Noticeable bend in the shaft, lumps under the skin. The fix? Wait until you're fully erect before penetration. And if you're struggling to get there, talk to a doctor. Don't risk permanent damage from one careless moment. Tip 4. This silent addiction is destroying real intimacy. It starts small, just a video or two. But if you're watching porn daily, it could be wrecking your brain and killing your erections. Why? Because porn rewires your dopamine pathways. Soon, your brain stops responding to real intimacy and only reacts to artificial stimulation. The NIH calls it porn-induced erectile dysfunction, and it's exploding in men over 60 who assume it's just aging. Symptoms include needing longer and stronger stimuli to get aroused, loss of interest in your partner, Inability to stay firm during real sex solution? Cut back to 1 to 2 times a week. Replace the habit with real connection or even meditation, and if needed, seek professional support, because brain chemistry can heal. Tip 5. The 3 lifestyle habits that shrink your manhood. Your penis is not separate from your body. It's connected to your heart, blood flow, and nerves. So what you eat, how you move, and what you breathe directly affects your sexual function. 3 silent killers you must address. 1. Smoking. Mayo Clinic warns it's one of the top causes of ED. Nicotine narrows your blood vessels, starting with the smallest ones first, like those in the penis. 2. Alcohol. Even moderate drinking lowers testosterone and damages liver function, which disrupts hormone balance. 3. Obesity and sugar. Harvard found that belly fat is strongly linked to erectile dysfunction and testosterone decline in seniors. Start simple. Walk 30 minutes a day. Eat leafy greens, nuts, berries, and fish. Cut processed foods and sugar-sweetened drinks. Stay hydrated. Your penis is 83% water. Your penis is a vascular organ. It needs clean blood, strong nerves, and healthy hormones to function. Treat your body like it matters, because it does. Bonus tip 6. The nighttime habit that causes hidden damage. Do you sleep wearing tight underwear? That one habit could be doing more harm than you know. Here's why. Every night, men experience multiple spontaneous erections, even if they don't remember. These are essential for tissue health and oxygenation. But if you wear tight briefs or constrictive fabric, you risk compressed erections, tissue trauma, over time, scar formation, and fibrosis. According to a Brazilian study published in Urology International, sleeping without underwear or with loose cotton boxers significantly reduced pressure-related penile trauma in men over 60. So the fix is easy. Ditch tight briefs, switch to soft, breathable boxers. Or best of all, sleep free. Give your body space to function how it's meant to. Now let me share something powerful. What if you could boost your blood flow, firmness, and confidence in less than 7 seconds a day, without pills, without injections, and without side effects? There's a natural at-home method that's already helped over 60,000 men. It restores nitric oxide, testosterone balance, and penile sensitivity, naturally. Doctors are starting to take notice, and men over 60 are saying, "This brought my marriage back to life." If you want to know what it is, scan the QR code or tap the link pinned in the comments. This isn't hype. It's science. Don't let embarrassment steal your health. These 6 tips could save your sex life, your confidence, and your independence. Because once you lose function, it's hard to get it back. But if you act now, you can preserve, protect, and even restore your manhood. The choice is yours. Ignore this and risk living with regret. Or take control and feel like yourself again. Your health, your power, your move.